Today we are going to discuss the joints of pectoral girdle. So we have two joints of the pectoral girdle, the sternoclavicular joint and the acromioclavicular joint. First of all, I'll discuss the sternoclavicular joint. In this picture we can see the joint over here is the sternoclavicular joint. This is a compound joint. A compound joint is a joint which has more than two articulating surfaces. As we can see here, it has the manubrium sterni, the sternal end of the clavicle, and the first costal cartilage taking part in formation of this joint. So the three structures taking part in formation of the sternoclavicular joint makes it a compound joint. Then this joint is also called a complex joint. A complex joint is one which has an articular disc in between the articulating surfaces. So this joint is a compound joint as well as a complex joint. The uh, inclusion of these three structures in formation of this joint makes it a compound joint, and the presence of articular disc here makes it a complex joint. Now the articular disc here divides this joint cavity into two compartments. One is the suprolateral compartment and one is the one is the supromedial compartment and one is the infralateral compartment. So the sternal end of clavicle, the manubrium sterni and the first costal cartilage, they are forming the sternoclavicular joint, and it is a compound joint, and the presence of this articular disc makes it a complex joint. Now we'll briefly discuss the various ligaments that are taking part in stabilizing this joint. We have four ligaments mainly. One is the sternoclavicular ligament, which is further subdivided into an anterior ligament and a posterior ligament. So the two ligaments, the anterior sternoclavicular ligament strengthens this joint anteriorly or supports it from the front, and the posterior sternoclavicular joint supports it from the back or strengthens it posteriorly. The third ligament is interclavicular ligament, that is attached to the two sternal ends of the clavicle as well as the superior surface of the sternum, manubrium sterni. So the interclavicular ligament supports this joint superiorly. And the last ligament of this joint is the costoclavicular ligament. It supports this joint from below. So the four ligaments are anterior sternoclavicular ligament, posterior sternoclavicular ligament, the interclavicular ligament, and the costoclavicular ligament. Now the blood supply of this sternoclavicular joint is the internal thoracic artery and the suprascapular arteries, the arteries that are passing through this area. And the nerve supply of this joint is the medial supraclavicular nerve and the nerve to subclavius. As we can see from this picture, the subclavius muscle is attached on the inferior surface of the clavicle. The nerve to subclavius passes from here and supplies this joint. Next joint of the pectoral girdle is acromioclavicular joint, and as the name indicates, this joint is between the acromion process and the acromial end of the clavicle. In this picture we can see this is the acromion process and this is the acromial end of clavicle, and this joint here is called the acromioclavicular joint. All the joints are surrounded by this joint capsule, and inside there is a synovial membrane and synovial fluid for smooth movement of the joint. The ligaments of acromioclavicular joint are, one is the acromioclavicular ligament that is attached from the acromion to the acromial end of clavicle. The other main important ligament is the coracoclavicular ligament. As we know that the lateral end of clavicle inferiorly has a structure called the conoid tubercle and a trapezoid ridge. So the costoclavicular ligament has two parts. One is the conoid part and one is the trapezoid part. The conoid part is attached from the conoid tubercle of clavicle to the coracoid process, and the trapezoid part is attached from the trapezoid ridge of the clavicle to the coracoid process. So this ligament, coracoclavicular ligament, has two parts, the conoid part and the trapezoid part, and these are strengthening the acromioclavicular joint inferiorly. Now the blood supply of acromioclavicular joint is the suprascapular artery and the thoracoacromial arteries vessels. Nerve supply is the lateral supraclavicular nerve, and lateral pectoral nerve and the axillary nerve. Now, one thing I need to mention here is that the nerve supply follows Hilton's law. What is Hilton's law? It is a law in which states that the nerve that is supplying muscles attached to that particular joint are also supplying that joint. In easier words, the muscles like deltoid and the pectoralis muscles, these are attached to the acromioclavicular joint, and their nerve supplies lateral pectoral nerve and axillary nerve. Hence, these nerves are also supplying the acromioclavicular joint. So mostly the nerve supply of the muscles, the joints generally follows Hilton's law. And Hilton's law is that the nerve that is supplying muscles attaching to that joint are also supplying the joint. In this table, we can briefly summarize the two joints of the pectoral girdle, the sternoclavicular joint and the acromioclavicular joint. The types are, it is a saddle type of synovial joint, and acromioclavicular is the plane joint. Plane joint, the movements that are taking place at a plane joint are the gliding movements. Now, articular surfaces, I have told you earlier, sternoclavicular joint is a compound joint because there are three structures taking part in its formation: the medial end of clavicle, clavicular notch of manubrium sterni, and the upper surface of first costal cartilage. And the acromioclavicular joint is a simple joint having lateral end of clavicle and the acromion process of scapula. Now, the articular disc that is present in the sternoclavicular joint, dividing it into a supromedial and an infralateral compartment and making it a complex joint. And the acromioclavicular joint has an insignificant articular disc. Joint capsule surrounds the articulating surfaces in both joints. Ligaments, I've told you the interclavicular, the anterior sternoclavicular, the posterior sternoclavicular, and the costoclavicular ligaments. These are the four ligaments strengthening sternoclavicular joint, and the acromioclavicular joint has the acromioclavicular ligament and the two parts of coracoclavicular ligament. Blood supply is by internal thoracic vessels and suprascapular vessels, and in acromioclavicular we have suprascapular vessels and the thoracoacromial vessels. Nerve supply is mainly from the medial supraclavicular nerve and the lateral supraclavicular nerve, and in addition it follows Hilton's law. The movements taking place at both these joints are the main movements of scapula, which are the elevation, depression, protraction, retraction, medial rotation, and lateral rotation. These movements I'll be discussing in the next video. Thank you.